Hi everyone, this is Dr. Allie Gosnell from Reshape Physical Therapy here in Winchester, Virginia. Today we're going to talk more about concussions. We're going to talk about the recovery timeline that you typically see for a concussion. And then we're also going to talk about if you were to come in for concussion management or rehabilitation and see an athletic trainer or physical therapist, what your treatment may look like. So let's talk about time length. How long does it take to recover from a concussion? A study by Collins et al. Took a look at some high school football players with concussions and saw how long it took for them to recover from the concussion. And what they found was that 40% of concussions recovered within a week, 60% of concussions recovered within 2 weeks, and then 80% of concussions recovered within 3. And then there is a remaining 20% that took longer than those 3 weeks to recover. Here at Reshape Physical Therapy, we typically see anywhere from a person who's 7 days out from their concussion and past that 21 days. We usually don't see them within a week because usually they're seeing their doctor or their athletic trainer that first week. And typically they don't need additional assistance from us as physical therapists until after that 7 days. After that 7 days, a person may need a little bit additional assistance, meaning some exercises, some return to play stuff to do or return to work exercises to build them back to where they were before they had their concussion. And some things that we end up doing when you come in is that we look at your signs and symptoms. We do a few screens to look at balance, to look at your ability to track things with your eyes, your ability to keep your balance while moving your head. We look at your neck for some range of motion things. We also may do what's called a neurocognitive test, which is that we sit you down at a computer and we have you go through a computerized testing that helps us look at a few components that we can't look at in a typical screen. It helps us figure out your reaction time, helps us know your cognitive abilities, as in your memory. And all that information put together, neurocognitive test, our screenings, your symptoms that you tell us, allow us to then put you into a category. So what type of concussion you may have. And that then helps us individualize your treatment so that you can get the correct exercises at the correct time and graded exposure to things to return back to where the individual was before they had their concussion. Now, there are 6 different types of concussions that you could have, okay? People can fall under one category, they can fall under multiple categories. We're going to go through a little bit of that here. So one is cognitive fatigue. Things typically seen, difficulty concentrating, difficulty performing exercise or physical activity. Another one is vestibular. Vestibular deals with your inner ear. So these people often have a hard time with balance. Another trajectory or type of concussion is ocular, meaning your eyes. So they might have difficulty reading. They might have difficulty tracking things. Might have difficulty in busy rooms. Another type of concussion is post-traumatic migraine. We see these in a lot of individuals who've had migraines before they even had their concussion. These people typically can have headaches, pressure in head, light or noise sensitivity. The last 2 coming up, cervical, which is your neck. And your neck can refer pain into your head, so give you headaches. So we take a look at that, especially because of the whiplash mechanism that typically happens with a concussion. And then finally, the last trajectory is anxiety or mood. We don't typically deal with this one solo, meaning that this is the only trajectory that somebody falls under. Usually we end up referring these individuals out to a more specialized healthcare provider to provide some additional assistance with that. But we do have patients that fall under multiple trajectories and end up having an anxiety and mood component, meaning that they're not able to turn the switch off and decrease their anxiety, or they may have a little bit of depression. So we can help in almost all these trajectories of a concussion. We end up giving exercises specific to those trajectories. And then what we end up doing is graded exposure sometimes, meaning that we gradually increase a patient's tolerance to being able to do certain activities to allow their brain to gradually accept or tolerate what's being asked of it. Because there's an injury to the brain, it takes time to recover. And sometimes the recovery needs a little bit of assistance to just take that next step. So if you guys have any questions, please shoot us a message. Otherwise, have a great weekend, everyone.